As I always say here on the Southern Scene, we all like to look and feel our best. Now, sometimes there are issues that we deal with that keep us from doing that. Are you one of those folks who suffer from sleep apnea? Well, there may be help for you out there. And we decided to visit one of our good friends, of course, Dr. Karen Cooper, who knows all about the sleep apnea and what you can do to maybe help your issue out. Thanks for joining us, Dr. Cooper.
Thanks, how are
It's
you?
so good to see you again.
As well.
So of course we're here, and when we talk about smile designs and keeping our smile healthy, I mean that's very important to you because if your mouth is not healthy and your smile is not healthy, you really can feel that throughout your entire body. It really can affect so many different health issues, and you've educated us about that here on the Southern Scene.
That is correct. I have. We've discussed quite a few topics.
So dentistry goes much further than just whitening your teeth or keeping your teeth clean or making sure that it's healthy. It's about keeping your entire body healthy.
Yes, and that's what we're talking about today is actually the TAP appliance. And with people that are dealing with sleep apnea, it's called obstructive sleep apnea is the formal name for it.
And of course, on the Southern Scene, of course, our viewers know we've talked about sleep apnea on the show, and so many people suffer from that, and they have no idea why. And for years, they just decide that this is something that they are going to have to live with. But the thing about it is it can be very, very scary as well.
And it affects the body as far as your sleep deprivation, as far as weight gain. All of these things can be affected. Hypertension can all be caused by sleep apnea.
And the scary thing about it too, aside from all of those things that you mentioned, is you are actually not breathing certain times while you're sleeping.
That is correct.
That is a scary thing, and it's not just once or twice that maybe you stop breathing. We've talked to patients who actually have stopped breathing hundreds of times in the middle of the night. That's quite scary.
That is, and what you'll find is that the person will gasp or choke, or you'll hear a cough as they're gasping for that air because the body is saying, hey, I don't have the oxygen I need.
When you're talking about sleep apnea, you don't realize that you can visit your dentist and talk about, is this something that you can help me out with? But you actually help a lot of people out with sleep apnea.
We do. The normal treatment with sleep apnea has always been the CPAP, which sometimes can be very cumbersome for some patients and difficult because of the larger mass. Where with this here, we're actually opening up the airway, and then sometimes where that sleep apnea is severe, there's combination ones now. And the TAP appliance is the only appliance that will actually connect to the CPAP.
So let's talk about the TAP appliance. Tell me exactly what this is and how it can be used.
What we do is we bring the patient in and we will take impressions and make a mold. And from that mold, there will be almost like a night guard or a stent that goes over the teeth on the upper arch and the lower arch. And then there's an appliance that actually connects the two together. In that appliance, what's neat about this one is the fact that you have a key. The patient has the key. So what we're doing is we're allowing the patient to adjust that lower jaw for comfort, because they can come into the office and sit one position and we adjust it, and then when they go home and they're actually lying back in the bed, their position of their jaw changes and then it's not as comfortable.
You have this appliance. Is this something that's really comfortable?
It actually is. I've had several patients come to me that could not wear the CPAP, and it just would not work for them. And we've worked with them with the TAP appliance, and they're just ecstatic. And they've been wearing them for years.
How does it open up your airways?
What happened is that for sleep apnea, or even with snoring is just partial obstruction of the airway. Whereas sleep apnea, you're actually is closing, your airway is closing. So there's a soft palate, which is a muscle, that normally keeps that area open. And when you're relaxed, and some patients just the amount of gaining weight, drinking alcohol, smoking, all of those are things that could cause you to go into having sleep apnea. But it closes the airway from this area, and then the tongue and the jaw drops back when you're lying on your back.
Oh, I see.
And so what we're doing is we're going to now push the jaw back forward, move the tongue forward, and open that airway back up.
Well, thanks, Dr. Cooper, for
Thanks.
joining us and, of course, educating us once again on the TAP appliance. Thank you so much.
Thank you.
If you'd like more information on Dr. Karen Cooper and Smile Designs, and you want to hear more information on the TAP appliance, especially if you're suffering from sleep apnea, all you have to do is go to the information you see right there on your screen. You can also find us on Facebook, The Southern Scene, and you can check out our website, wsav.com. Just click on our Southern Scene page. We'll make sure we put you in contact with Dr. Karen Cooper.